When we talk about potassium, we talk about the soil test as the principal tool for assessing potassium nutrition in corn. Another tool in our toolbox is an assessment of the ear leaf tissue at pollination. So using a soil test to establish what thresholds are in the field and coupling that with a tissue test provides more accurate long-term tools for looking at soil potassium management. So when we look at a corn plant as it grows in a farmer's field, it germinates, shoots out a few leaves, and establishes a root system. This happens between germination and growth stage V4. In that time frame, potassium is taken up at very slow rates, 0.5 pound, 1 pound per acre per day. Once that root system is established at 5 leaves, the plant starts into the rapid growth phase. A corn plant can take up as much as 8 to 10 pounds per acre per day for a very short period of time while that stalk's being developed. An assessment of the ear leaf tissue at pollination provides good information about the status of K in the plant. Over the past 15 years, we've established critical values for corn ear leaves as terms of potassium nutrition. Potassium in the ear leaf below 2% concentration indicates a deficiency of K in the corn. Our results show that growers having less than 1.8% potassium in their corn ear leaves at pollination have suboptimal yields averaging 40 bushels an acre less than corn that has more than 2% leaf potassium. For growers who have adequate soil potassium levels and find that their tissue test levels say that they're suboptimal on their ear leaf K, they should probably consider using side dressing between growth stages V4 and V6 to meet the maximum crop demand. A typical soil test in the Midwest costs an average of $10 to $12 per sample. Thus, a grower who samples once every 4 years on a 2.5 acre grid is probably looking at a cost of $1.60 per acre. In comparison, a tissue sample pulled once a season on 3 to 4 locations in a field would have a cost of $100. When we look at the tissue testing industry, there's many labs who have capability to do good quality laboratory testing on tissue analysis. Looking at potassium management in the bigger scale, a farmer using a soil test to establish what his field levels are, and then coupling that with a tissue test one time at pollination provides a good management tool for assessing what his fertility program is on target or not.